New data from the Indiana Department of Health breaks down vaccinations by zip code. We took a closer look and found that some neighborhoods just a few miles away from each other are worlds apart when it comes to vaccination rates. Local leaders say it's an issue bigger than the COVID-19 vaccine.
Healthcare has been a problem with trust in the black community for a long time.
Larry Gist, the president of the NAACP, says it dates back to the time of slavery.
Blacks were not always treated or given the same type of health care as others.
But how does that play a role in this story? An examination of vaccination rates by zip code finds predominantly white neighborhoods like the 46814 and 46845 zips are seeing full vaccination at twice the rate of minority communities like the 46803. Gist says while COVID-19 may be a novel virus, there's nothing new about the problem. Many black Americans know too well the 1930s in Tuskegee, Alabama, and the study of untreated syphilis in African American men.
Some of the young people don't know about that, but they've heard about that through their grandparents, and that belief is still in their head.
This is not the same thing as Tuskegee.
Gist and the Allen County Health Officer add this is not just distrust deterring the black community. Lack of resources and transportation in lower-income neighborhoods also plays a role. With the county's primary main vaccine sites at Parkview North and the Coliseum, it's been hard for folks in some neighborhoods to get there.
And the South Side really felt the effect of that. They had some locations here on the South Side, but the shots were minimum.
He adds that time of appointments make it difficult for those working to make it. Dr. Sutter recognizes the challenges.
I understand the distrust. I understand that people would be hesitant.
Sutter, like Gist, says he is working on educating those who have reservations.
To try and work with community leaders to get the message out there that these vaccines are safe and effective and free.
Sutter adds it's more important than ever for the black community to get their shots. And with new options like a clinic at McMillan Park, he hopes more people will have easier access to the vaccine, which he says is essential.
People of color are actually disproportionately affected in terms of the effect of infections of COVID-19.
As for Sutter's message to those who are afraid,
there's a lot of misinformation out there, but this is the scientific consensus. COVID-19 is a serious infection. Many people do well with it. However, a number of people will die or have long-term effects as a result. These vaccines are safe and effective. There are occasional serious side effects with these, but they're very rare, and they're a tiny fraction of what you'd expect from a COVID-19 infection itself. There's just no comparison.
This is what we need to do. And it's not that the government, when you go get the shot, they're going to take a batch out of this basket and a batch out of that basket, because of, of the color of your skin. It's the same shot. I'm watching it.
We should note, it's not just race and income affecting vaccine rates. Zip codes that skew younger are lagging in part because most young adults have only been recently able to get the shot. You can see how your neighborhood is faring if you head to our website, WPTA21.com. Click on this story to access the latest data.